Hey y'all, it's Rochelle, Hot Doc Shelly Smith, and today we're going to be talking about bacterial vaginosis, which is also known as BV. So, bacterial vaginosis is a type of vaginal inflammation caused by the overgrowth of natural bacteria found in the vagina, and this causes an imbalance in the vaginal pH. Women in their reproductive years are most likely to get BV, but it can also affect women of any age. BV is the most common cause of vaginal discharge complaints. So, what are some signs and symptoms of BV? Thin, gray, white, or green vaginal discharge, foul smelling, fishy vaginal odor, vaginal itching, burning during urination, and some women don't have any signs and symptoms. So, what causes BV? So, usually the good bacteria, which is lactobacilli, is outgrown by the bad bacteria, which are anaerobes. And if there are too many anaerobic bacteria, this can upset the natural balance of the microorganisms in your vagina and leads to vaginal bacterial vaginosis. So, some risk factors could include having multiple sex partners, a new sex partner, or a female sex partner. BV occurs more often in women who have multiple sex partners or a new sex partner. Bacterial vaginosis also occurs more frequently in women who have sex with women. Douching. So, the practice of rinsing out the vagina with water or a cleansing agent, as well as an internal manual washing, can disrupt the vaginal pH. So, since the vagina is self cleaning, douching and internal manual washings aren't necessary. And when I say internal manual washings, that means taking a finger or a towel with soap or water inside the vagina to clean the vaginal canal. This is not necessary. You want to use a mild soap on the external only, okay? So internal washings are a high chance of increasing your risk for BV. So if your natural vagina environment doesn't produce enough of the good lactobacilli bacteria, you're more likely to develop BV. Uncircumcised male partners can increase your risk for BV, and the menstrual cycle can also alter the vaginal pH, causing an increase in BV prevalence. So, what are some complications from BV? Sexually transmitted infections are increased in women, such as HIV, herpes, chlamydia, gonorrhea. If someone has HIV, bacterial vaginosis increases the odds that they will pass the virus on to their partners. Bacterial vaginosis can sometimes cause pelvic inflammatory disease, which is also known as PID. This is the infection of the uterus and the fallopian tubes that can increase the risk of infertility. Having bacterial vaginosis may also increase the risk of developing post-surgical infections after procedures like a hysterectomy or a DNC. And it can also, in pregnant women, increase their chances for preterm deliveries, a low birth weight for their babies. So, how can we prevent BV? This is the burning question, right? So you want to minimize vaginal irritation by using mild non-deodorant soaps and unscented tampons or pads. You want to avoid douching or internal manual washings. Your vagina doesn't require cleansing other than the normal bathing. So frequent douching disrupts the vaginal pH and may increase your risk for vaginal infections. So to be clear, douching will not clear up a vaginal infection. It can increase your risk for one. You want to avoid sexually transmitted infections by using male condoms. You want to limit the number of sex partners or abstain from intercourse to minimize your risk for sexually transmitted infections. So, how do we diagnose BV? You want to discuss your medical history with the provider. They may ask you about previous vaginal infections or STIs. They probably perform a pelvic exam to visually examine your vagina for signs and symptoms of infection. They may also insert two fingers in the vagina while pressing on the abdomen just to see if there are any indications of disease of the pelvic organs. And then they will also take a sample of the vaginal secretions by using a swab. This would check for overgrowth of anaerobic bacteria in the vagina. The doctor may also examine the vaginal secretions under a microscope looking for clue cells, which are vaginal cells covered with bacteria that is a sign of BV. They will also test your vaginal pH by either placing a pH test strip inside the vagina or by damping the swab on the test strip to see if the pH shows that it's greater than 4.5. So, what are some treatments for BV? Some common treatments include metronidazole. This medicine may be taken as a pill, 500 milligrams by mouth twice a day for 7 days. Metronidazole is also available as a topical gel, also known as Metrogel, that can be inserted inside the vagina nightly for 5 nights. The pills may cause stomach upset, abdominal pain, or nausea. There was a restriction at one point on the use of alcohol during oral treatments, but the new CDC guidelines state that there is not enough data to support that there's a reaction. So refraining from alcohol while taking this medicine is unnecessary. Nuvesa, is a single dose gel inserted vaginally. So that's kind of fairly new within the last few years. Clindamycin, you can take 1 capsule twice a day for 7 days. This medicine is also available as a cream that you can insert 1 applicator full inside the vagina nightly for 7 nights. Clindamycin cream may weaken latex condoms and diaphragms during treatment, so you want to make sure that you're protecting yourself at least for the first 3 to 5 days after completion of use. So, tinidazole, which is also known as Tindamax. This medication is taken orally 2 grams once for 2 days or 1 gram orally for 5 days. Tinidazole has the same potential for stomach upset and nausea as the metronidazole does. However, restricting alcohol use with treatment is also not necessary anymore. Solosec, this is an antibiotic that you take orally in 1 dose, 2 grams. This medicine comes in a packet of granules that you sprinkle over applesauce or put in a yogurt, but it must be eaten within 30 minutes. It's important not to chew or crush these granules. So it's generally not necessarily to treat an infected woman's male sex partner. However, bacterial vaginosis can spread between female sex partners. So female sex partners should seek treatment. It may need treatment as well, testing and treatment, especially important for pregnant women with symptoms to be treated to help decrease the risk of preterm delivery or low birth weight. You want to take your medicines as prescribed. So stopping your medications early may increase your risk for reoccurrence. So in regards to reoccurrence, it's common for bacterial vaginosis to recur within 3 to 12 months despite treatment. One option may be extended use of metronidazole therapy, either the 0.75% of the Metrogel or 750 milligrams of the metronidazole pill. Vaginal suppository twice weekly for greater than 3 months have reported to reduce the recurrence. A self-help approach is to increase the lactobacillus colonization within the vagina. So this is an attempt to boost the number of good bacteria in your vagina and reestablish a balanced vaginal environment. This can be accomplished by eating certain things like yogurt. You can also use probiotics by mouth to help with this. And then boric acid vaginal suppositories are also commonly used. I do have an affiliate with Amazon, so there will be a link posted above in the comments and in the description. So you can click on there to get easy access to boric acid vaginal suppositories and probiotics that I do recommend in practice. So I hope this gave you a lot of information about BV, which is the most common complaint for vaginal discharge. So I want you to have this information, know how you should treat yourself and the ways to avoid frequent BV. I hope you share this information with those around you. Some women do have us, think it's very embarrassing to have BV, but I just want you to be educated and know what you need to do to take the proper precautions to avoid it. So I hope you have a good night. Y'all be blessed. Peace.